Space research is partially to thank for the world's best-selling drug, cancer drug Keytruda, for getting a new, easier-to-deliver form for patients. Now, there are some pros and cons to this being approved, so let's get into it. So Keytruda is a drug currently approved to treat 18 different types of cancers, but up until now, it had to be delivered in a clinic via IV in a solution. The big change? The FDA has approved an injectable version that can be given in just a doctor's office in a few minutes. This is a drug that has to be given pretty often during cancer treatment, so this not only frees up patient time, but it also frees up chairs in clinics that can be used instead for chemotherapy. And a huge step in figuring out how to make this injectable was research done on the International Space Station in microgravity. To be able to make this type of medication injectable, it needed to be made at a high enough concentration, but also runny enough that it can be actually put through a syringe. To avoid this medication becoming syrupy, scientists needed to create a fine crystal suspension, and one of the best tools to do that was microgravity. Medical research in space involving growing protein crystals is actually pretty common. This is a really important part of a lot of drug development, and when you take gravity out of the equation, more refined crystals can be grown. In this case, Merck, the company that creates Keytruda, was looking to see if crystals created in microgravity happened to be smaller and more standardized. And guess what? They were. Instead of making all of these crystals up in space, they were able to figure out how to recreate the necessary conditions of microgravity here on Earth to create these same types of crystals. You can sometimes simulate a lot of the conditions of microgravity in these sort of rotational machines that create simulated microgravity. So, by using these rotational mixers and the temperature gradients that they found were appropriate in space, they have been able to create this now injectable version here on Earth. So it's really cool to see space research create a better version of a medication that is going to help cancer patients in hospitals here on Earth. Now, the con though, it's going to keep costs for this medication very high for a lot longer. Prices come down on medications when patents expire and new copycat versions are able to create their own versions of that medication and create competition. But now, no one's going to want those copycat versions of the IV solution version. This delays the time until those copycat versions, now years down the road when the new patents on this version of the medication expire, are able to help bring those costs down and create new versions of it. So pros and cons, but again, very cool to see this drug get advanced through space research.